Hi, my name is Holly and welcome to the News Beyond the Markets, a special show that'll get you all the news that matters for the day. Well, fight against the Delta virus variant is definitely keeping all of us on our toes. Let's have a look at the infection numbers and the lockdown scenario. First up on the show are the updates from the National Cabinet meeting held today to discuss the recent COVID-19 outbreak in Australia. The National Cabinet discussed Australia's COVID-19 response and the COVID-19 vaccine strategy. Across the country, a number of new community outbreaks have appeared in Greater Sydney, Brisbane and the Sunshine Coast, the Darwin region and the Perth-Peel region as well. Concerningly, a number of these outbreaks are linked to the Delta variant, which has significantly higher transmissibility. Health measures have been put in place by the National Cabinet throughout the pandemic. The measures have been effective in bringing outbreaks under control and reducing the severity of the health impacts. While there are now over 270 active cases in the country, there are only 2 cases in ICU and no Australian is on a ventilator, thankfully. Looking at the infection numbers since the beginning of the pandemic, there have been 30,528 confirmed cases in Australia and sadly 910 deaths. More than 20.4 million tests have been undertaken in the country, and notably testing has increased nationally over recent days, with 628 tests reported in the past 7 days. Meanwhile, there have been over 181 million cases and over 3.9 million deaths globally. The COVID-19 pandemic continues to surge in many countries around the world, showing no signs of slowing down. Moving on to the brighter side, with the rising cases in Australia, the COVID-19 vaccine rollout continues to expand. To date, 7,374,666 doses of COVID-19 vaccines have been administered in Australia. Around 28.6% of the Australian population aged 16 and over have at least had their first dose of a vaccine, which includes those over 68. It has been seen across the globe that COVID-19 vaccinations are working to reduce transmission. National Cabinet promoted in a recent exposure event in New South Wales. Of the 30 people that were at the event, 24 unvaccinated have now been tested positive for COVID. On the other hand, 6 vaccinated people who attended the event have not been infected at this stage with the virus. Hence, the National Cabinet agreed to work together to administer COVID-19 vaccines to all Australians as quickly as possible. Meanwhile, Chief Medical Officer Professor Paul Kelly provided an update on the current outbreak of COVID-19 in a number of locations and of both the Alpha and Delta variants. The National Cabinet also agreed to changes to Australia's quarantine arrangements in a bid to minimise the risk of transmission. The Cabinet noted the importance of national coordination, and Lieutenant General Freeman reaffirmed that all states and territories are provided COVID-19 vaccinations on a proportional population basis. To date, 10.8 million doses have been allocated to states and territories, general practices, and Aboriginal community-controlled health organisations, as well as the community pharmacies. There are more than 2.6 million doses of AstraZeneca currently available to be administered. The Commonwealth will establish a COVID professional indemnity scheme to provide additional certainty to healthcare practitioners. In today's meeting, the National Cabinet agreed to mandate that at least the first dose of the vaccine be administered by mid-September 2021 for all residents of aged care facilities. The Commonwealth will support this decision through an employee vaccination support grant. Residential aged care workers will be supported to be vaccinated through an $11 million program. The program will enable them to attend off-site vaccination centres and general practices as well. Well, these times are really concerning, but on the behalf of Kalkine Group, we urge our viewers to stay safe and take good care of your health. On that note, we'll be taking a small break, but stay with us and I'll be back in just a moment.
New Zealand is unique, and Kalkine TV is here to bring you all the latest news and trending market updates. Streaming across multiple platforms, so no matter where you are, whether it be at the beach or on the farm, you can count on the team here at Kalkine TV to be your home for accessing the latest valuable insights into global issues that are affecting New Zealanders. Subscribe to our channels across YouTube, Facebook, also visit kalkine.co.nz.
Welcome back, I'm Holly and you're watching the news beyond the markets on Kalkine TV. On to more updates on the grant for residential aged care facilities. Under the grant, these facilities will be paid eligible expenditure, a flat fee of $80 payable per staff member. Per dose will be paid to casual staff going off-site for vaccination. 1 day's paid leave at a rate of $185 for up to a quarter the provider's total number of casual staff will be paid. This paid leave will be for casual staff who become unwell after vaccination and do not have other leave entitlements. There will be facilitation of off-site staff vaccination for employees for up to $500 per site. The National Cabinet will also agree to changes to Australia's quarantine arrangements to minimise the risk of transmission from high-risk international travellers in managed quarantine facilities. From designating different facilities or zoning through allocating separate areas in a facility, quarantine facilities will ensure safety for all. National Cabinet further reaffirmed that managed quarantine for international arrivals continues to play a vital role in Australia's public health response to COVID-19. National Cabinet noted that the Commonwealth will establish a COVID-19 professional indemnity scheme to provide additional certainty to healthcare practitioners who are providing advice to people in relation to the vaccination. The scheme covers COVID-19 vaccines provided by the TGA and approved for the vaccine program. GPs can continue to administer AstraZeneca to Australians under 60 years of age with informed consent. This measure will provide confidence to medical practitioners to administer both AstraZeneca and Pfizer vaccines to Australians. And on to more updates from the rising COVID-19 cases in Australia. New South Wales has recorded 19 new local cases from the 67,000 tests in the last 24 hours. On the other hand, Queensland state capital Brisbane and some neighbouring regions will also enter a 3-day snap COVID-19 lockdown from Tuesday evening. About 2 million people in the city, the country's third largest, will be required to stay home except for essential work, healthcare, grocery shopping or exercise. And on to news that comes as a relief for Australians. Bendigo Bank has outlined its support for customers adversely financially affected by the pandemic restrictions. Impacted customers are encouraged to contact the bank as soon as possible to discuss the range of support options available to them. Managing Director of the Bendigo Bank, Marnie Baker, said that the bank wants to assure those negatively affected by the latest rounds of restrictions that they are ready to help. An array of financial difficulty assistance measures has been made available by the bank, who announced assistance to businesses who require financial help during this difficult time. These measures are available to all customers, and the bank is giving the ability to apply for relief on existing loans, whether that is a home loan, residential investment loan, line of credit, personal loan, business loan, or personal credit card. The fees have been waived to restructure or consolidate loans, and there will be no interest rate reduction for early withdrawals for on-term deposits. Well, that is the end of our show just for now, but keep watching Kalkine TV as we bring you the latest news and trending market updates live from Sydney. Holly Shields signing off.